Many people feel puffy and tired all the time. They may suspect they have thyroid issues, but their doctor has reported that the test came back fine. While some people may already be taking thyroid meds and they just stopped working, and now they have no idea what to do. Let me share with you some key insights about lab testing that can make all the difference for your thyroid health. When women complain of low energy, weight gain, brain fog, hair loss, chances are your doctor may test your thyroid. When testing for thyroid issues, the conventional approach is to check TSH, or thyroid-stimulating hormone. While this may seem like a sound idea, and you definitely want to look at blood work, it only gives you very limited data that can miss other imbalances in thyroid hormones like T4 and T3, your stress hormones like cortisol and DHEA, estrogen, progesterone, and testosterone as well. So what ends up happening is that your TSH may be normal and you're told that your thyroid health is fine, but that may not be true because they have no idea what's happening with some of these other hormones. Or if your TSH is off, thyroid medication may be prescribed, but they may not consider that there's likely other causes like gut inflammation, adrenal dysfunction, or other hormone imbalances that are causing your TSH to be off in the first place. Your adrenal and gut health also play a role in how you circulate and store hormones in your body. For example, if you tested, your estrogen level may be normal because the levels are okay in your blood, but it may be building up in your body because you can't detox it properly. We call this estrogen dominance. This is why so many women that are on thyroid medication or estrogen replacement don't feel any better. I also see where you may have had dosages changed on a regular basis because your symptoms keep getting worse over time, or the blood levels are on a roller coaster ride, while the gut and adrenal health goes completely ignored. And finally, you find yourself in a state of deep chronic fatigue, possibly dealing with autoimmune issues as well. In my practice, our goal is to get the complete picture of why you're having symptoms and why maybe your thyroid isn't working optimally. We also strive to understand how these hormones may be impacting each other so that we can make adjustments instead of giving a one-size-fits-all thyroid or estrogen replacement therapy that may not be what you even need. You could be struggling with adrenal issues, poor insulin regulation, gut infections, or your liver may be overburdened. What's frustrating is that you may feel better in the short term because adding more external hormones hits those receptors, giving you a short-lived boost, but your symptoms often worsen over time when that honeymoon period is over. I see this often with hormone pellets that can be a treatment for women going through menopause. A huge dose of hormones is inserted under the skin all at once and repeated every 3 to 6 months. While this seems convenient, it can be very shocking to your body and cause other complications, and many times feels great in the beginning, but later those symptoms return. So when you have symptoms, we have to test, not guess. We don't make any assumptions here. When we do take a deeper look at all your thyroid hormones, we not only look at TSH, but what's also happening with your free T3 and free T4. Our comprehensive hormone testing also includes all 3 types of estrogens: estrone, estradiol, and estriol. This is crucial for understanding your breast cancer risk associated with estrogen as well. Here's a little known fact: only 5 to 10% of breast cancer is related to having the gene. So you've got to look at other risk factors like estrogen storage and toxins to reduce your risk. We also test for progesterone that can decrease during the perimenopause period and create common symptoms like fatigue, irritability, weight gain, brain fog, poor sleep, irregular cycles. Low testosterone can cause decreased libido and fatigue. DHEA can impact your testosterone and energy, and cortisol, which is crucial for your overall hormone balance and energy. In some cases, we may even look at melatonin for your sleep. A lot of people blame weight gain, fatigue, and many of these other symptoms on your thyroid, or say it's just menopause, when in fact it may be caused by poor adrenal function or other hormone imbalances. So you need to understand which pieces of the hormone puzzle are out of place. We also focus a lot of energy on regular detox, since everyday toxins can throw all those hormones off. To go deeper on the topic of thyroid health, register for my free video series on rebalancing hormones naturally. Simply click the link next to this video.